arrival of COVID-19 has created unprecedented challenges for the world. In Indonesia, the coronavirus has infected more than 1 million people since the first confirmed cases in March 2020 and tens of thousands have died.
Coronavirus curbs on the economy and society continue to have a shocking impact on human development. After years of progress, poverty is rising again.
One in 10 people in Indonesia today are living below the national poverty line. Child poverty may increase significantly. The social impact would have been far worse had it not been for government assistance.
In response to the crisis, the government of Indonesia has introduced a massive fiscal stimulus package to the national economy recovery programs. Indonesia ranks among the top 5 countries in the Asia-Pacific region in terms of the total amount devoted to combating COVID-19.
In 2020, the government allocated 695.2 trillion rupiah, approximately 49 billion US dollars to the program. With the crisis still unfolding, the government announced a budget of 699.43 trillion rupiah, approximately 49.3 billion US dollars in February 2021 for the continuation of the PAN program this year, Kemenke 2021.
Indonesia has continued to invest strengthening its social protection program to respond to the crisis. These have been expanded to protect today's poor against major shock as well as a growing number of low and middle income earners who have become vulnerable and are at risk of becoming the most of poor. Small businesses are receiving assistance as they continue to contend with a contracting economy and public health resistance.
To assess the impact of COVID-19 on Indonesia's households and to inform government police, UNICEF, UNDP, Prospera, the Samaru Research Institute, and the National Statistics Office collaborated on a groundbreaking survey in October to November 2020.
The survey included 2,260 nationally representative households across all 34 provinces. It was the largest survey of the impact of COVID-19 so far and focused on children and vulnerable groups.
It was based on face-to-face interviews with households interviewed by National Statistics Office as part of its National Socio-Economic Survey 2019 (SUSENAS). The survey and analysis were undertaken in close collaboration with the Indonesian government.
Impact of COVID-19 will continue throughout 2021 and beyond. However, the pace of support must continue to boost child and family well-being. Indonesia development partners stand ready to assist in this endeavor.
The arrival of the COVID-19 pandemic created unprecedented socio-economic challenge for Indonesia. Mobility restriction measures have helped to curb the spread of the virus and save lives, but have also created a socio-economic crisis for many Indonesian families. Income inequality has risen during the pandemic as economic shock have most strongly impacted the poorest and most vulnerable households.
Indeed, Indonesia's economic recovery at first have faced considerable challenges, with the poverty rate remaining at 10.15% and affecting 27.5 million people as of February 2021.
The nationally representative survey, which include more than 12,000 households, is the largest of its kind in Indonesia to understand the socio-economic impacts of COVID-19 on households with children, women, and people with disabilities, with guides and inputs from the Fiscal Policy Agency, Ministry of Finance and Statistics Indonesia. The first round of the joint assessment was conducted in November 2020, revealing the impact of COVID-19 on household socio-economic condition was severe.
The pandemic also placed children in a vulnerable position as they face multidimensional challenges, ranging from learning difficulties and limited social interactions to obstacles in accessing health services. In 2020, social assistance reached a large number of low-income households, but more needs to be done to expand its reach. Between December 2020 and January 2021, an additional 3 rounds of rapid surveys were carried out with the same 2,400 households, this time using interactive voice response or IVR rather than the original face-to-face methods.
Follow-up surveys paint a picture of a period that, while the country was resuming its economic activity and working towards full economic recovery, at household level the recovery remained fragile. During this time, at least one member of every two households lost their job. Approximately 45% of households with children struggle to find enough nutritious food to feed their families, with many eating smaller portions than usual. Challenges with running were reported by 9 in 10 respondents with school-age children.
And that's our discussion of opportunity and challenge for Indonesian society from the COVID-19 pandemic.
Our hope, of course, as young people, the successors of the nation hope that the country's economy will improve continuously, hoping that the government will not be too selfish to enjoy its position up there and forget the people who are under it.
Hopefully, it will get better and more stable for us Indonesians, so that we can truly realize the golden Indonesia 2045 and become the next generation of the nation that is responsible and not arbitrary towards people who are more in need. May we always be given health and sufficient sustenance